Good morning, dear student. Today we are starting our second unit, and first topic of second unit is drug distribution system in hospital. In first unit, we already studied about the hospital, type of hospital, hospital pharmacy, organization of hospital pharmacy, functions of hospital pharmacy, drug adverse reaction, and in last class yesterday we studied about the community pharmacy. Now, today we are starting drug distribution system in hospital. You go through the all slides and also make a notes, running notes with this class because this is important. You must know the drug distribution system in hospital. Now, this is drug distribution system. Drug distribution is a continuous process of receiving drugs from supplier, moving them safely, securely to the many points in the healthcare system at which the drugs will be dispensed to the patient. What is the main object of drug distribution? To procure the drug from the uh, supplier and safely it reaches to the patient for the administration. That is the main aim of drug distribution. This drug distribution is done in a hospital in both type of patient, inpatient and outpatient. Inpatient, that is admitted in a hospital, uh, and outpatient, they are visiting to the hospital for the treatment and diagnosis purpose. Now, this is a chart. If you have pen and paper, please note down. This is a chart of drug distribution cycle. Here you can see drug procurement from the supplier, ports clearing, receipt and inspection, whether the supplied drugs are proper and good quality or not, inventory control, you stored in a proper manner in a store, then storage, then recognition of supplies, uh, which department is asking to the medicine, whether nursing staff, pharmacy staff, hospital pharmacy, floor pharmacy, and delivery to the supplies to particular department or particular pharmacy, and dispensing to the patient as per the prescription of the physician or as per the requirement of the patient. Next is consumption report. It is prepared by the pharmacist. Number of drugs are consumed or supplied to the patient or particular department. And consumption, after the consumption report, the again demand will generate for the procurement of drug. This is a drug distribution system or cycle in a hospital. Now you can see this recognition of supplies. How we will give the recognition of supplies? That is two type of system: pull system and push system. Pull system, that is each level of system determine what types and quantity of drug are needed and place order with the supply source. This is a pull system. Now push system, the supply source at some level in the system determine that what type of quantity of drugs will be delivered to lower level. in both type of system, difference is there. In full system, we are giving the requisition and for the to the central store, we are giving the requisition to the central store for the requirement of medicine, but in push system, the central pharmacy or central store is known. This much is requirement is you needed in this month or in this week. They are giving that particular or delivering that particular medicine or particular drugs or particular supplies to your pharmacy. This is pull and push system. Now, distribution of distribution to outpatient. The outpatient service provide the main linkage of the hospital with the community. Here, direct patient coming from the society or community for the treatment. And outpatient is one who, after the consultation with the physician or pharmacist, receive the treatment without being admitted. These are the outpatient. They are coming for the consultation with the physician or pharmacist and taking the treatment with the prescription, and they are not admitting in a hospital. Medicines are given to the outpatient on the basis of prescription. There shall be benches provided for the patient to sit during the waiting period. A number of students you may be visited in the Hamidia Hospital or Kasturba Hospital. They are having such kind of pharmacy. They are distributing the medicine on the free of cost to the outpatient on the prescription basis. There shall be benches now. Poster of health education and community health programs may be displayed in the waiting area. Some leaflets and some drug information bulletin also they are keeping in that particular area. Water supply or some good quality air passage also is there to patient. They can sit properly to wait for their turn to taking the medicine or from the pharmacy. That is, you can see very good manner. Kasturba Hospital is managing pharmacy in very good manner. You can see in BHEL area in Bhopal also. Now, distribution of medicine to the inpatient. Inpatient are admitted patient in a hospital, stay there for the treatment till they are discharged. The pharmacist service to inpatients will vary depending upon the departments. Inpatient supply, generally admitted patient drugs distribution through the nursing staff. Now, in various department, number one, that is radiology department, medicine required for uh, diagnose purpose. In operation theater, some anesthetic liquid and injections, infusion solution, surgical gauges, cottons, antiseptic solution, and some injectables they supplied to the operation theater as per the requirement of a day. In ward, apart from the medicine, catheters, cotton lint, bandages, etc. are called medical supplies in a ward. Uh, Three type of drug distribution system in a hospital. A is a floor or ward stock system. In this system, All but the most unusual drugs items are stocked on the nursing station. That is happen in a floor wise, first floor, second floor, third floor, like that. Uh, that drugs are stored in a nursing station. Similarly, same thing happen in a ward, burn ward, child ward, and female ward, male ward, like that. We are keeping the drugs as per the requirement. Now, drug products which require special control, like anti-cancer drug, anti-neoplastic, are often omitted from the floor stock. These drugs is supplied on the basis of prescription and are sent to the nursing staff unit upon receipt of the pharmacy of the prescription order for the individual patient. Now, all containers used for floor stock must meet a specific labeling requirement as addressed in the rules. Uh, B type individual prescription order system. Here in this system, all medication are dispensed by the pharmacist on the individual prescription order. That is that is distributed to the patient on individual basis on the on the behalf of prescription of physician or pharmacist. The combination of floor stock, C is the combination of floor stock and individual prescription order. In this system, most of drugs are dispensed on the individual prescription basis. The remaining drugs are obtained via limited floor. Now, for this, unit dose dispensing system. This is important. In this system, medications are contained in a single unit package. They are dispensed in a ready to administered form as possible for the most medication. This type of medication is generally administered by the nursing staff on the time basis, morning, afternoon, evening, like that. Unit dose dispense system, that particular dose of medicines they are giving to the particular patient. All doses will be labeled properly to include name, strength, expiration date, or lot number and control number both. Now you can see the unit dose dispensing, the multiple or single dose administration of medication are prepared by pharmacists which are ready for the administration to the patient as per prescribed by the physician. A single unit package is one which contains complete pharmaceutical doses form for a one time. There are two methods of the dispensing of unit dose. First is CUDD, that is called Centralized Unit Dose Drug Distribution System, and uh, another is DUDD, that is Decentralized Unit Dose Distribution System. Now, the charging policy of the medicine, the hospital should have uniform schedule For the charging of drugs, the policies can be categorized under the several system, like all inclusive. Your treatment is inclusive. All medicine charges also inclusive in your treatment. That is, lump sum bill will come after the at the time of your discharge. Uh, Next is a part inclusive rate. Another is the part portion is inclusive and part you have to pay on the taking of medicine on prescription. Uh, Another charging policy is the professional fee concept. Another is break even point purchase. Now, next is a cost plus rate system. Another is the profit aspects. And next is computerized pricing. These are the charging policy is followed by the on various hospital on their mm, daily practice. Some government hospital, they are giving all the medicines on free of cost. Some charitable hospital, they are giving some medicine on free of cost, and some they are charging, and some they include including in their final bill, and some they are not including. They we have to purchase uh, on the basis of prescription or requirement uh, at time to time to the pharmacy department. Now, labeling. The labeling is ultimately reflect the pharmacy department. The pattern of labeling is as follows: name, dosage form, and strain. Earlier, I told you in this lecture this pattern: strain, batch number, expiry date, and special direction if it is necessary. This labeling is very important as per as guidelines for the patient and guideline for the nursing staff to deliver or administer the dose to the patient. Now, dispensing of controlled drugs, that is controlled drugs, that is restricted drugs, or they are giving only on the prescription basis, or their prescription is must be written by registered medical practitioner or physician. A separate register is maintained for controlled drugs. Various steps involves are as follows: the medical superintendent is overall responsible for the handling of controlled drugs. Chief pharmacist procure, store, responsible for proper dispensing of drug within the hospital. Now, required information is given below. You can see the full name of patient, address of patient, date of dispense must be written in the top of the label. After that, top of the record, and after that, name and strength of drug, quantity of drug, signature of prescribed. This is very important. Prescriber signature must be present in your record, because you can't distribute these drugs directly to the patient, because that is comes under the control category. Now, dose and route of administration also be mentioned in your record. Now, these are the important criteria of drug distribution system in hospitals. You must know, and some 4 marks question or short note question will come in an examination of this topic. And you must remember, sometimes they are directly ask the floor drug distribution system or ward drug distribution system. then you have to answer of drug distribution system, and you have to make a chart of earlier I show you in this class uh, drug distribution chart that you have to draw in that answer, in your answer. If any question you can ask, or you can separately ask on my WhatsApp, and you go for your prepare for the sessional examination that is scheduled in this month, uh, last in this month, because we have less time of conducting, whether we are conducting online basis or uh, this offline basis, that we will decide in later. You must prepare for both. If exam is conducted on online basis, then we will ask that question in the form of multiple choice. And if we are conducting the offline basis in this month, or early in the October, then you have to write descriptive answer. So be prepared, and maybe chances is there your examination, final examination, maybe university will take on offline basis in the December or January. So be prepared, and prepare proper notes. Any question in first unit or this chapter, you can directly ask to me. Now, today this much from my side. Thank you very much. If any question is there, you can ask.